The news tonight is grim. Across every major network, anchors deliver the same chilling message: America is facing an unprecedented crisis. The headlines are stark, the graphics urgent, and the sense of dread is palpable in every newsroom. A deadly new strain of avian influenza, H7N9, is spiraling out of control across the United States. What began as a handful of isolated cases has now exploded into a full-blown national emergency, with the virus spreading faster than anyone could have predicted. Ambulances race through city streets, and health workers clad head-to-toe in protective gear work around the clock to contain the outbreak. Maps on television screens show the virus's relentless march from coast to coast, leaving no region untouched. Hospitals are overwhelmed, schools and businesses are shuttered, and the familiar rhythms of daily life have ground to a halt. Once bustling city centers now stand eerily silent, their streets deserted as people shelter indoors. Playgrounds are empty, office buildings dark, and the hum of daily commerce has vanished. The nation's heartbeat has slowed to a fearful, uncertain pause. The CDC has confirmed over 150,000 cases nationwide, a staggering jump from just a few thousand last month. The numbers climb higher each day, with health officials warning that the worst may still be ahead. Charts and graphs show a steep, unrelenting curve, and the news tickers scroll with sobering statistics that change by the hour. Makeshift medical tents fill city parks, the National Guard enforces quarantine zones, and essential supplies are running out. Supermarket shelves are stripped bare and long lines form outside pharmacies and food banks. Soldiers stand guard at checkpoints, their presence a stark reminder of the extraordinary measures now in place to try to slow the virus's spread. The official response has been chaotic and slow, fueling panic and confusion. Press briefings are marked by mixed messages and shifting policies, leaving citizens unsure of what to believe or how to protect themselves. Anxiety ripples through communities as people scramble for information and basic necessities, their trust in leadership eroding with each passing day. As the virus tightens its grip, a painful truth emerges. This disaster was years in the making, rooted in critical blunders by the previous Trump administration. Investigative reports reveal a pattern of ignored warnings, underfunded agencies, and a lack of preparedness that left the nation dangerously exposed. Protesters take to the streets, demanding accountability for the failures that have now come home to roost. Warnings went unheeded, experts were silenced, and vital public health programs were dismantled. Laboratories that once led the world in disease research now sit idle, their doors closed due to budget cuts. Scientists who raised alarms were pushed aside, their expertise dismissed at the highest levels. The infrastructure meant to protect Americans was systematically weakened, leaving the country vulnerable when it mattered most. Now the consequences are being paid in human lives, and the bill is still climbing. Intensive care units are filled to capacity, nurses and doctors stretched to their limits, and families mourn, loved ones lost to a crisis that could have been mitigated. The nation watches, heartbroken and angry, as the true cost of inaction becomes tragically clear. This disaster did not appear overnight. For years, leading epidemiologists and global health experts issued urgent warnings about novel influenza strains. Intelligence reports as far back as 2018 specifically flagged H7N9 as a major threat, urging immediate action. The global health community was on high alert, but in Washington, these calls were met with indifference. The Trump administration disbanded the White House's global health security team, slashed CDC budgets, and shut down key surveillance programs in China. These decisions left America flying blind as the threat grew. Experts warned a pandemic was inevitable, but the administration chose to ignore them. The nation's smoke detectors were dismantled, even as the smell of smoke grew stronger. The most devastating blunder was rejecting a proposal to modernize the Strategic National Stockpile, our emergency reserve of medicines and supplies. The plan to acquire new antivirals and replace expired N95 masks was shelved as too expensive. The administration also withdrew from key international health partnerships, isolating the U.S. from vital early data. Attacks on science and sidelining experts like Dr. Fauci eroded public trust, fueling misinformation and non-compliance. The PREDICT program, which identified new viruses, was gutted, blinding America to emerging threats. Pennywise, pound-foolish decisions prioritized short-term savings over national security, and now, we're all paying the price. The experts who tried to warn us are now speaking out, their voices a mix of vindication and sorrow. For months they raised red flags, urging action, but their warnings were often dismissed or downplayed. Now, as the crisis unfolds, these same experts are stepping forward not to say "I told you so," but to help us understand what went wrong and what must change. Dr. Evelyn Reed, former CDC official, recalls the early days. "We saw this coming, we presented the data, we pleaded for resources and attention, but our concerns were brushed aside. It was like shouting into the void. Defunding surveillance was like taking the batteries out of a fire alarm. The systems designed to detect and respond to threats were left powerless, unable to alert us in time. When the first signs of trouble appeared, we were already dangerously behind. Now my former colleagues are fighting a fire with garden hoses. The tools they need are missing or inadequate, and every day the blaze grows larger, harder to control. Social media is ablaze with anger. Protests erupt outside federal buildings, and the public's frustration is boiling over. People are demanding answers, accountability, and real leadership in the face of mounting chaos. Panic buying sweeps the nation as fear spreads faster than facts. Store shelves are stripped bare, and families scramble to secure basic necessities, unsure of what tomorrow will bring. Dr. Michael Chen, an infectious disease specialist, shares his frustration. Public health was treated as a political liability, not a national security imperative. We were sidelined when we should have been leading the response. Instead of listening to science, political debates took center stage. Health officials were dismissed, their expertise questioned, and critical decisions delayed by bureaucracy and partisanship. We lost the golden hours to contain this. Those precious early moments, when decisive action could have made all the difference, slipped away as leaders hesitated and systems faltered. The result, a delayed, disorganized, and inadequate response. Hospitals scrambled to adapt, emergency plans were improvised on the fly, and confusion reigned where there should have been coordination. Healthcare workers are stretched to the breaking point, working double and triple shifts, often without proper rest or support. The emotional and physical toll is staggering. Forced to reuse masks and ration care, frontline staff are making impossible choices: who gets help and who must wait. Supplies run low, and every day brings new challenges. For many, this feels like a betrayal, one that's costing lives on the front lines. The sense of abandonment is palpable, as those who dedicated their lives to saving others now find themselves unprotected and unheard. The consequences of ignoring expert warnings are no longer abstract, they are measured in lives lost, and in the heartbreak of those left behind. The outbreak began quietly in rural Iowa on October 15, 2025. In the early hours of that autumn morning, life in these small towns seemed unchanged. Farmers tending fields, children heading to school, neighbors greeting each other at the local diner. But beneath the surface, an invisible threat was already spreading, unnoticed and undetected, setting the stage for a crisis that would soon engulf the nation. Underfunded local health officials, already stretched thin by years of budget cuts, mistook the first cases for nothing more than a particularly harsh seasonal flu. With limited resources and outdated equipment, they struggled to keep up with the growing number of patients, unaware that this was only the beginning. By November, the CDC had finally identified the culprit, a new strain of H7N9. But their efforts were hampered by a lack of crucial data, the result of dismantled global agreements and weakened international cooperation. Scientists worked around the clock, but without access to information from other countries, their warnings came too late. The federal response was sluggish and disorganized. For 2 critical weeks, as the virus silently spread from town to city, national leadership offered only vague reassurances. Press conferences were filled with empty promises and shifting blame, while behind the scenes, agencies scrambled to coordinate a response that was already falling behind. By Thanksgiving, the situation had spiraled out of control. Major outbreaks erupted in cities across the country. Hospitals were overwhelmed, emergency rooms overflowing with patients, and the first heartbreaking reports of healthcare worker deaths began to surface. The nation watched in shock as the crisis deepened. December brought devastation on a scale not seen in generations. Case counts tripled in a single week, with hospitals pushed to the brink. Medical staff worked double shifts, exhaustion etched on their faces, as the virus tore through communities with relentless speed. As the virus surged, supply chains broke down, supermarket shelves emptied, businesses shuttered, and once bustling streets fell silent. Fear and uncertainty replaced the trust that once held communities together as people struggled to find food, medicine, and hope. The Miller family in Illinois became a symbol of the crisis's human cost. All 4 members were infected, despite following every recommended precaution. Their story echoed that of countless families across the country, ordinary people caught in extraordinary circumstances, facing an uncertain future. The father, once healthy and strong, now lay on a ventilator in the ICU, his life hanging in the balance. The beeping of machines and the steady hum of oxygen were constant reminders of the fight for survival taking place behind hospital doors. Their children, both under 10, struggled to breathe, their small faces masked and frightened. With no antivirals available and hospitals running out of supplies, the family's ordeal became a desperate battle against time and circumstance. "We did everything right," says Sarah Miller, her voice trembling with emotion as she recounts the steps they took to protect themselves. "We followed every guideline, every rule, but it wasn't enough. But the system failed us. We feel completely abandoned." Her words echo the frustration and heartbreak of thousands of families left to fend for themselves as the healthcare system buckled under the weight of the pandemic. The Miller family's story is a heartbreaking testament to the real-world cost of political negligence and systemic failure. Their loss, and the losses of so many others, serve as a stark reminder of the consequences when warning signs are ignored and preparedness is neglected. The political fallout has been swift. The current administration is scrambling to respond with sabotage tools and resources. Public confidence is plummeting. 78% of Americans now blame past policies for the crisis. Former President Trump denies responsibility, calling the outbreak a hoax and blaming others, fueling dangerous divisions. Political polarization is proving as deadly as the virus, hampering a unified response. Congressional leaders are demanding investigations into the dismantling of pandemic defenses. This crisis exposes the catastrophic cost of placing politics above science. Pandemic preparedness is national security. Neglecting it has left the country vulnerable, with consequences measured in hospital wards and cemeteries. The path out of this crisis is uncertain and will require immense resolve. The best-case scenario, strict nationwide lockdowns, mask mandates, and a rapid surge in medical supplies could slow the virus and save lives. The worst, continued division and misinformation could collapse the healthcare system with a death toll in the hundreds of thousands. A third, grinding scenario would see cycles of lockdown and reopening, with lasting economic and psychological scars. The future depends on our actions now, especially vaccine development and public cooperation. We can unite behind science, or let division lead to unimaginable loss. The road ahead is uncertain, but our direction is still within our power to choose. This crisis is a tragic lesson in the interconnectedness of our world. The Trump administration's retreat from global health cooperation ignored a basic truth. Viruses don't respect borders. Weakening partnerships and surveillance cost us our early warning system. At home, years of neglect left our public health infrastructure vulnerable, and trust in science eroded. Combating H7N9 now means fighting both a virus and a flood of misinformation. When we invest in evidence-based public health, we save lives. The tragedy is that we failed to apply this lesson where it mattered most. The safety of the nation depends on treating public health as the vital, nonpartisan issue it is. The path forward begins with acknowledging the failures that led us here. We need a transparent, nonpartisan investigation into the dismantling of pandemic preparedness. Accountability is the first step to rebuilding trust and a resilient system. Massive reinvestment in public health, restoring CDC funding, rebuilding the stockpile, and re-engaging with global partners are essential. The public must combat misinformation, support health workers, and demand leaders prioritize preparedness. This is a moment of reckoning. The H7N9 outbreak is a tragedy, but it can be a catalyst for change. We must choose to rebuild, reinvest, and recommit to science and cooperation. Our future is not yet written. The actions we take now will determine whether this crisis is a dark chapter or the moment America finally woke up.